Welcome to the Healthcare Provider Happy Hour. This is a safe space where we invite healthcare providers to unapologetically be themselves after the working day. My name is Jennifer George, and each week I will connect you with guests and stories that will help transform your stress to success and fulfillment. Are you with me? Grab your drink of choice and let's chat. Hey everyone, welcome to the Healthcare Provider Happy Hour. I'm your host, Jennifer George, and I'm joining you today with Dr. Frank Douglas. Frank is the CEO of Safe Haven Dialogues, which is an organization that empowers individuals to become agents of change against systemic discrimination. Frank also holds his Ph.D. in physical chemistry and his medical degree from Cornell University. In this episode, we chat about a reframed methodology for handling the stress impacts of discrimination in the workplace. The methodology includes equity, inclusion, and individual engagement, EIIE. This was a great conversation. I really think you're going to get a lot of value from this, and it's something that you can also take away with you to your workplace and become more aware and also practice. So grab your drink of choice. You don't want to miss this conversation, and join us. Hi, Frank. Welcome to the show.
Hi, how are you, Jennifer? Thanks for the invitation.
Thank you for being here and accepting. I've been looking to have this conversation with someone on equity, diversity, and inclusion, and your evolution of that as well. And that's one of the reasons why I wanted to chat with you, is because I just appreciate your perspective on stress in the workplace and how it's all connected to inclusiveness and discrimination, and having a conversation around this. So thank you for being here.
Yes, and I appreciate your sensitivity to the issue.
Yeah. Can you first tell us about yourself? Like, what have you not done? When I read your bio, I'm like, there's nothing this person has not done. So I want you to tell us what you want us to know about you, because it's quite amazing to me. So
thank you. Well, I was born in Georgetown, British Guiana, now Guyana, of course. Came to America at age 20 on a Fulbright scholarship as an undergraduate, and did my bachelor's degree in engineering at Lehigh University, then went on to Cornell and did both a PhD in physical chemistry and an MD, and later trained in internal medicine at Hopkins and at the National Institute of Health, where I also did a fellowship. I have been both an academician as well as been in industry. The larger part of my life actually was in the pharmaceutical industry, where, in spite of challenges of discrimination, I actually became the first Black to be on the board of management of a top 5 global pharmaceutical company, where I was responsible for global research, development, and regulatory affairs, and also had the wonderful opportunity of leading scientists who brought to market, who innovated, developed, brought to market more than 25 drugs, including drugs for cancer, hypertension, tuberculosis, osteoporosis, etc. I also spent time in academia at MIT, as well as at the University of Akron, where I actually led and introduced a number of approaches. I led an institute that brought together the 3 hospitals in Akron, the University of Akron and the medical school, to basically take advantage of the tremendous strength in polymer science and engineering at the University of Akron to find solutions for several tissue-related diseases.
Wow. So how did you evolve from basically working in physical medicine, essentially, as well as engineering and bioengineering, perhaps, pharmaceuticals, to now stepping into discrimination, equity, diversity, and inclusion? How did you evolve from there to here where you are today?
Two things, actually. About 5 years ago, as I tell people in my third retirement, uh,
I love
I,
it.
I started to write my memoirs more as to silence a cousin of mine who for many years would say to me, if people only knew how you grew up in Guyana, they will be astounded to see the leadership that you have on a global scale. And as I was writing my memoir, something struck me. And if I might tell you the story that struck me, because it is related to what I do now.
For sure.
When I completed my PhD, I was hired by Xerox. And for 3 months, I could not get a meaningful project. And one day, a white young man joined the group, and within a week, he was placed on the hottest project we had in research and development at Xerox at the time.
Wow.
So I went to my manager to have another discussion. And I finally said to him, look, Steve, don't think of me as though I'm Frank. Think of me as though I'm Bob. Mm. And I was just stunned to see the recognition, come across his face as he said to me in a very knowing way. He said, Bob has only been here a week and I've already put him on the Ardrey project. Well, I was furious. Mm-hmm. I made it out of his office, went down to the office of the senior vice president to give him yet another example of where I was being discriminated against. Now, about 2 or 3 years later, I thought about that incident and realized I had missed two things. One was that this senior vice president had hired 3 young Black PhDs that summer to join the one Black PhD that Xerox had at the time. So it probably was more important to him that Frank Douglas would do well than it might have been important to Frank Douglas himself. The second thing was that I really was not terribly interested in the senior vice president having tough words with my boss. I wanted a good project. Right. That was the outcome I wanted. So had I reframed and had I said to the senior vice president, Dr. Tribus, could you help my manager find me a good project? I might have retired at Xerox. Wow. Because that was certainly within his sphere of influence. He was 2-3 levels above my boss, and he walked into my boss's office and said, look, find a man a good project. It would have been done.
Wow.
Well, as I was writing my memoirs, and I told, that story and my recognition of the error I made, it suddenly occurred to me that, as a matter of fact, the way I had dealt with problems is that I was reframing. And so I had learned from that. So that was one aspect. The second aspect was looking at the George Floyd incident and looking at the onlookers on the side doing their darndest to try to get Chauvelin to take his knee off of George Floyd's neck, to no avail. But the reality is there was one individual who was suffering and, as a matter of fact, dying that day. And that struck me that during my time, both in industry and academia, whenever there was a discrimination problem, there was always an aggrieved individual. And although, and we've done a lot, with diversity, equity, inclusion type programs, we focus on trying to get the environment to become sensitized, to understand about microaggressions, etc. And we don't do much for the individual.
Yes.
And I asked myself, had George Floyd learned some skills, would the outcome have been different? Would he have handled himself differently? So I brought those two things together and immediately formed a group, which I call Safe Haven Dialogues, to really focus on empowering individuals to understand the issues in their organization, to be clear about the outcome which they would like, and then to take them through a process to enable them to find a better problem to solve. Which problem would not only get them to their desired outcome, but also would be of benefit to their workmates and to the work unit.
So you're really empowering the individual, essentially.
The focus is to empower the individual.
Correct. Okay. You're right, though. Like, I'm just reflecting on all of the work that's being done and all of the organizations that are expressing and making equity, diversity, and inclusion a part of, their values and everything of that nature. But you're right, it's done at a global level. It's not really educated upon, but it's more done from like kind of admin down in a way, right? And maybe programs are being done, workshops, webinars, but I think, like you said, we're not really focusing on the individual themselves as well. And everybody's needs are going to be different. Everybody's barriers are going to be different as well, right? We don't really know what necessarily somebody is going through or what they're experiencing unless we give them an opportunity to share that.
Absolutely.
Am I getting it? Okay.
No, you have it perfectly.
Yeah.
Unless we give them an opportunity to share what they feel, and unless we get an understanding of how the systems or lack thereof in the organization, how they are contributing to how that person feels, unless you do those two things, unless you are able to walk in the shoes of that individual,
right,
not much learning actually occurs.
So true.
There might be empathy, but really not much learning occurs. So that's the one aspect. The second aspect is to have the individual not feel like a victim, but for the individual to understand that there are opportunities here where they, one, become empowered to express what is going on, and the two, where they can, as a matter of fact, have a dialogue, which dialogue talks about, I may be suffering from this, but as a matter of fact, there may be others who are suffering from this. And if we were to address this particular aspect, it would improve productivity, not only for myself, but also for the unit. And the third aspect of it is we look at the issues around inclusion and the issues around equity in the organization as it is affecting that individual. And when you do that, again, as you observe a specific case, you learn more about the problems in the organization with respect to equity and inclusion. So you really get an opportunity to walk within in the shoes of the individual.
Wow. It totally makes sense to me, but it's a very different way from the way I've seen it, right? Like just the perspective that you're sharing. And one thing I did notice when you shared your story is that's one thing I totally connected with, was that you didn't see yourself as a victim. No. As you were sharing the story, and then you mentioning that just validated my understanding of that. So the evolution that Safe Havens Dialogues has done with equity, diversity, and inclusion is now it's equity, inclusion, and individual engagement.
Yes.
Okay, so can you tell me why diversity was taken out of that acronym? Can you elaborate a little bit more on the principle?